is Eunice Kinywa from Kisumu, Kenya. I work for Ministry of Health in Kisumu County, where I coordinate HIV and STI activities for a particular sub-county, which is a sub of the county. And I think my experience in working with the LGBTI community, at one point we had a sensitization session with the health workers, and this challenge I faced based on the invitation that was done to the healthcare workers. Somebody told them that they were coming in for a sensitization for most at-risk population. So I have this kind of one health worker who came in, and at the back of her mind, she was like thinking she's going to discuss issues as regards to children and pregnant women. And on reaching there, when we started talking, and we also had some of the community members coming in to also share their experience, she just went berserk. Boom! And she was like storming out that she can't work with these people, because at the back of her mind she had this notion that she was coming to discuss issues based on children and pregnant mothers. So it had to take the intervention of me together with another counselor to talk to her that they are part of the community and we have to serve them. And so I think this really exists. The reason why this is there is because there's lack of communication for people, for even the healthcare workers to know that this community exists and they come to our facilities and they actually need to be able to be served. So how I wish that this would actually be incorporated in the pre-service training, because in the pre-service they just taught on how to deal with the typical sexes, and this is hardly handled. So at the end of the day, even as somebody is qualified, that interpersonal relationship with this community doesn't exist, and it actually takes a lot of intervention for you to actually build that in them, for them to have that good interpersonal relationship with the LGBTI community. So basically, I think it's really important that this be incorporated in the pre-service trainings, that the health workers would actually be aware that yes, as much as we are talking about the typical male-female, but we'll also have these other people who are there and they access our health services. So we have to know they are there and we have to see how best to serve them.